Just a few short months ago, most of us were blissfully ignorant of the existence of COVID-19. We've been on a steep learning curve ever since, and that's been helped along by medical and scientific coverage in the media. Some of the most interesting writing on this pandemic has come from Ed Yong. He is a science writer for The Atlantic, and he joins us now from Washington, D.C. And Ed, it's good to see you again. How are you managing through this pandemic?
I'm okay. I'm at home like everyone else, but I'm holding up. Thank you.
Good to hear about it. You've been writing about this virus, as we suggested, for several months now. Is what scientists know about the virus today much different from what they knew about it when it was first identified?
Yeah, some things have clearly changed. We now know that this new coronavirus, SARS-CoV-2, can transmit from one person to another before symptoms start appearing. And that is probably the most important thing we've learned about the virus in the last few months. It complicates our ability to control it. It means that it is harder to slow its transmission, but not impossible. Other things about the virus still remain annoyingly, frustratingly unclear. To what extent is it moving among children, for example? To what extent are these asymptomatic cases contributing to the spread of the disease? And really importantly, why are some people who get infected becoming very severely sick, while others don't seem to suffer many symptoms at all? All of these things are still being discovered, still being investigated.
You've asked some great questions there. Do scientists that you talk to think they are any closer to an answer to any of those questions?
We're making progress all the time. I would say that science on this virus has progressed incredibly quickly, considering, as you noted, that merely a few months ago, no one knew that this thing even existed. Now we have its entire genome mapped out hundreds of times over. We have its entire structure mapped out in atomic detail. But with some of those epidemiological questions, how it spreads, what it actually does, these are much more difficult. And the world is not only having to answer those, but having to answer those in the middle of a pandemic. The scientists and researchers who are looking at these questions are also under stay-at-home orders, and they're also having to be careful to socially distance themselves, to wash their hands thoroughly. All of those things complicate our understanding of the virus. But I do think the science is moving along very rapidly, and I'm hoping that a clearer picture will emerge within the next few months or so.
Well, you haven't just called it a pandemic, you've called it a patchwork pandemic as it relates to the country you're in right now. Why did you call it that?
So different parts of the US are experiencing the pandemic in very different ways. So some of the states that were most badly hit at the start, like New York, in those states, the pandemic is actually waning, cases are falling. But in other places like, say, Texas or North Carolina, cases are only now starting to take off. And other places, it is plateauing. If you put all of these together and average them out, you get what has been a national plateau for much of April and now a shallow decline. But that is masking a lot of these very, very stark variations across the country. And that patchwork, those differences in how America is experiencing COVID-19 is going to complicate our ability to understand how the pandemic is playing out, our ability to predict what is going to happen next, and it makes controlling everything that much tougher because states where things are still taking off could conceivably seed new outbreaks into ones that have previously had it under control. And so we're going to enter this very difficult whack-a-mole phase where we keep on having to suppress and contain the virus as it pops up and as it moves across the country into new areas like rural and suburban areas that have not experienced it before, and as places that have already seen it experience resurgences at different times.
How much of that is because of, I mean, you've got the same kind of division of labor, if you like, in government as we do here. We have a national government, we have provincial governments, and then of course we have municipal governments, and everybody's theoretically got somewhat different responsibilities for that. You have the same kind of situation in the United States where the national government does its thing, but then the governors have a great deal of power to do their thing. Is trying to coordinate all of those different responsibilities part of the reason why you've got this patchwork pandemic in the US?
Undoubtedly so. There was always going to be a patchwork precisely for that federalist setup that you talked about. And there is some logic to that. A governor or a mayor is better poised to know what matters to their community and what their needs are than someone working in DC, where I'm currently based. But they can't do it on their own. Federalism only works if the federal government takes some responsibility. Not only do they have the deep pockets that are necessary to fund the kind of massive public health effort we now need to fight this virus, but they also can ensure that supplies are purchased to a degree that leads to economies of scale, and they can coordinate the distribution of those supplies across the country in a way that is actually matched according to need. Instead, what has happened is that the Trump administration has taken a very hands-off approach, has reneged on its responsibilities, and has left the states to fend for themselves. So now we have a super capitalistic, completely absurd situation where states are having to bid against each other for supplies, where they're having to bid against even the federal government, against other countries. And this means that instead of having the response being tailored to the needs of different parts of the US, it is being tailored according to people's wealth, their connections, and that is a ludicrous way of fighting a pandemic. It means that the responses for each of the different states depends on things like leadership, on money. It is hugely varied. Some states will be fine, others will really suffer, and as a result, the entire country will be weaker. The sum of its response will be less than the sum of its parts rather than greater.
Hmm. Well, Ed, what you just said can't be true because I'm sure I heard Donald Trump say not too long ago that he thought the United States under his leadership was doing a fantastic job, a 10 out of 10, and that if there were any problems, he wasn't taking any responsibility for any of them.
Yes.
Have I got that wrong?
That he definitely has said that. I think that this level of misinformation from the White House is part of the problem that is leading to the patchwork not only intensifying but also fraying. It means that different parts of the US perceive the threat of the pandemic in very different ways, depending on how they thought about the man at the highest level of office. Now, that difference, that partisan gap in understanding of the pandemic has reduced over time. Currently, if you look at people in the US, upwards of 70%, maybe 75, 80, all agree that social distancing is important, that the states should be slow and patient and careful in reopening, that things like masks are important. And that degree of unity that transcends Republican and Democratic divides is almost unheard of. 70% of Americans don't agree on anything, but you find them agreeing on this. And you see polling numbers that you just don't see in this country. You see them in like authoritarian regimes, but this is a place where if like 55% of the populace agree on something, that is viewed as strong support. And now we're seeing numbers in like the 75% range. It suggests that there is actually a staggering amount of unity across America. Now, that may not last. That is at risk because of this amount of misinformation. But I think because more and more of the US is experiencing the virus firsthand, not only in their own bodies, but also in those of families and friends, they are starting to unify in their concern and their call for responsibility.
Okay, Ed, I am going to ask you a serious question this time, and that is yesterday we did an interview with a professor at the University of California in San Francisco, and she lives in Berkeley. And she was telling us that in her zip code, there are no cases of COVID-19, zero. But then you look across the country at a place like New York City, which is also a very densely populated part of the country, and they've just had a devil of a time with it, particularly in places like Brooklyn, where they have had numerous cases. And my question is, does science have a good explanation as to why two densely populated parts of the country can have such widely different experiences with COVID-19?
Yeah, so there are many possible reasons, and I think what I would caution viewers against is looking for any one factor that makes a difference. So I do think that social distancing restrictions, which were rolled out earlier and more effectively in some parts of the country than others, have made a difference. We know that as a virus that spreads exponentially, where cases can grow to a much faster degree than people expect, it really makes a difference when you put restrictions in. A matter of a week can make a huge difference to the resulting number of cases and deaths. But there'll also be other factors at play, things like the wealth and healthcare of a different state, how compliant the public is about social distancing restrictions, how much they use things like masks, the age structure, how people from different age groups mingle with each other. All of these things will make a difference. And I think it is very perilous to look at two places, one that did well and one that did not, and try and work out why and pin it on just one thing. And especially you see a lot of rhetoric that uses that kind of thinking and in arguing that lockdowns weren't necessary or that people have overreacted. And I think that is a big mistake. We look across the country and across the world, and we see that early decisive action from leaders can make a huge difference and has contributed to the reduction of cases and the swift control of the pandemic in places that implemented them. And that's what we should be thinking about right now.
In which case, and to that end, has the federal government, in your view, provided useful guidelines to the states on how quickly or slowly they should reopen their economies?
I don't think it has. The Trump administration has released a plan, a very vague plan on reopening that I described in my recent piece as being like a recipe for cake that just says, make cake. It is just so lacking in detail that it is not useful to the states. And many of the state leaders and state public health people I've spoken to have basically said that they've ignored it, or at least tried to come up with their own much better, much more detailed strategies. The CDC, what should be the leading public health organization, not only in America, but across the world, has been silenced throughout this pandemic. It did produce a very thorough, much more detailed plan and was blocked from releasing that by the White House. I believe that some slightly abridged version of the plan was finally released last night, but some would argue that that is too late, that a lot of states have already done their own thing. And that has contributed to the intensification of this patchwork. The fact that states have felt unable to rely on the federal government for guidance and advice has meant that they have largely been forced to do their own thing.
Let us now share with our viewers and with our listeners who are on podcast, and I'll read it out for that reason, something that you wrote in The Atlantic just last week. You wrote, "Further outbreaks are likely, although they might not happen immediately. The virus isn't lying in a bush, waiting to pounce on those who reemerge from their house. It is instead lying within people. Its ability to jump between hosts depends on proximity, density, and mobility, and on people once again meeting, gathering, and moving. And people are. In the first week of May, 25 million more Americans ventured out of their home on any given day than over the prior 6 weeks." It sounds like you are describing a situation where this thing is, if we don't follow the protocols and stay locked down in a very real way, this thing's coming back with a vengeance. Is that right?
I think that looking at what has happened in parts of the world that seem to have had it under control would definitely suggest that this virus is not going anywhere. It's still out there, and most of the world has not been infected yet. So most of the world is still susceptible to it. If you look at places that had it under control, places like Lebanon and South Korea, those places have seen resurgences and been forced to reinstigate some of the restrictions that that looked like they were being lifted. Now, it doesn't mean that if we lift restrictions, things are going to start being noticeably bad very quickly. And that's one thing I cautioned against in my piece, that it's not as if the day after a reopening, you'll suddenly see a rise in cases. It'll take a while before the virus starts moving from one person to another. And even after people get infected, it can take a week before symptoms show, and more time before those symptoms become severe enough that people go to hospitals and then show up, unfortunately, in death statistics. So there's a long gap between our actions and the consequences of those actions, which means that, for example, the declines in cases that we're seeing now in May are the result of social distancing actions that people took in April, and that the reopenings that we're seeing now and some of the more reckless behavior that we've talked about are really only going to be manifestly noticeable in June. And that gap makes it very difficult to appreciate what we're doing now and to appreciate the costs and the benefits of our actions. If I've stayed at home for 2 months, that is not going to be immediately and viscerally felt by me. And likewise, if people go out into the world right now, it's going to take some time before the consequences of that inaction, that incaution, becomes obvious. And by that point, it will be difficult to bring things back under control again.
In which case, let's talk a bit about whether there is another way. And by that, I mean we have heard a lot of conversation lately about a vaccine or about particular drugs that may or may not work or may not be helpful in retarding the progress of this thing. Too much talk in those regards? What do you think?
I think those are definitely important. A vaccine is clearly the end game, and that will take a long time to make. There is no shortcutting the vaccine process if you want to do it safely. So people have been talking about an 18 to 24-month time frame. Drugs will probably arrive much sooner than that, thankfully, but we should note that antiviral drugs are not cure-alls. They're not panaceas. They don't take people who are very sick and suddenly make them magically completely healed in the way that a lot of antibiotics for bacterial infections can do. So we shouldn't expect them to be able to suddenly bring COVID-19 to heal. Fortunately, the measures that can make a difference are not super complicated. They are things like testing for the virus, like tracing people who might have had contact with infected people, like isolating the people who are infected. These are old school 101 public health measures. We can't roll them out to the degree that we need to because there hasn't been enough investment and coordination from the federal government, but that could potentially change. And like I note in my recent piece, social interventions can make a huge difference right now. Just something as simple as making sure that everyone has adequate paid sick leave will mean that people who are infected and symptomatic, but who work in essential, low-paying hour-to-hour jobs can afford to stay home and isolate themselves rather than feeling that they need to go into work to put money on the table for their families. With those actions, we don't need to wait for a vaccine. We can do that right now, and it will make a difference right now.
Indeed, although I have heard, and you just did it here as well, I've heard people who are smart and who know about these things say it could take as long as 24 months to get a vaccine out there and to be effective. I forget the guy's name. You probably remember. You'll tell me. Somebody speaking in Washington the other day, representing the Pentagon, representing the Department of Defense of the United States, who said by Christmas there's going to be a vaccine and we're all going to be fine. Do they know something we don't know, or what's going on?
So I've definitely heard those more optimistic claims. And look, maybe something is going to, maybe that will happen. I would love for that to happen. It would make things a lot easier. But unfortunately, a lot of the people I've spoken to do feel that it's going to take longer to make a vaccine, that shortcutting is going to be very dangerous and should not be done if it can be done at all. That 18 to 24-month time frame, some would even say that that is optimistic. You then need to roll out a vaccine. You need to overcome a lot of the hesitancy that occurs around vaccination. Optimism isn't going to deliver a vaccine. Wishful thinking won't deliver a vaccine. Research delivers vaccines, and that does take time to do.
You know, many have pointed out that we never did find a vaccine for HIV. And HIV has been around for a very long time. I don't know what it is now, 30, 35 years. Could this virus be like that, in as much as we never really figure out how to prevent it from hitting us, but we learn how to live with it?
That is a possibility, but I think those two viruses are different in some important ways. HIV is notable for mutating very, very quickly. And that is one of the reasons why a vaccine is so difficult. There are also other unique factors about features of the virus, including the fact that it hits the immune system itself, that makes it a uniquely different challenge for making a vaccine. Influenza is another disease that is really important. We do have a vaccine against that, but that again mutates very quickly, which is why the vaccine needs to be updated on an annual basis. I don't think that this new coronavirus is going to fall into either of those categories. And my suspicion would be that a vaccine is possible. But you're right in that it's not a guarantee. So even that 18 to 24-month time frame is banking on everything going right across a large number of different steps. Now, some of the early signs do seem to be promising, but they are the first steps of many potential and necessary ones.
Could you tell me your view of the advisability of the Trump administration deciding not to continue funding for the World Health Organization?
Yeah, I think that's a very dangerous move. I think that in many ways it is meant to distract from the administration's own failings. This idea that the WHO failed in its duty to warn the world about the coronavirus early, regardless of how you feel about that, whether the week, or whether like a week of delay at the start really mattered, it is clear that the US did not make use of what warning it had, and that even at the point when it became clear the threat that the virus posed, the US has not jumped into action quickly enough, and still has not, even now that the pandemic is sweeping across the country. So I think it's a problem, and I think it weakens America's position in the global health area. America, the CDC, has long been looked at as an example in global health spaces as a leader. And I think that position is now well and truly lost, not only because of how badly the US has handled the virus out of all proportion to how prepared it should have been, but also in the way that it has reacted to the global health community, not just the defunding of the attempts to defund the WHO, but also in its relationships to other countries. It is ceding not only the country itself to the new virus, but also its position in the global sphere.
Do you know, part of the explanation was that the administration feels that China is playing a disproportionately influential role in the WHO, and we know what this administration thinks about China. The president mentions China all the time. Does that cause you to bevel the edges of your answer at all?
I think that's a really good point. And China does have a pretty patchy track record with its transparency around this particular pandemic. And many of the critics of the WHO's response have noted that it was probably unduly deferential to China at the very earliest stages. But equally so, the US using political leverage to punish the WHO for that is really exacerbating the problem. This is about that. The problem being that wealthy nations should not have undue leverage and influence over this organization that is meant to protect the health of the entire world. And the US is doing exactly what is trying to sort of instill exactly what it is saying the WHO should be able to withstand from other nations. And also, people have noted to me, people who look at global politics and global health, that regardless of your feelings of China, like if you think that they have screwed up and they have badly prepared the world for what is happening right now, what the US is doing is effectively playing into China's hands, because China is playing this soft political game in sending out supplies and sending out aid to other affected countries, whereas the US is making matters worse. It is withdrawing into itself. And if you wanted to sort of create a situation where the US trades some of its political power in global health to China, this is the type of situation we're looking at. So if you are if you deem yourself to be an American patriot and someone who is criticizing China's response, this is exactly the wrong way of responding to that.
Well, Ed, I have to say, you've done just absolutely the best and most splendid reporting on this subject, which is a complicated one that we all want to know so much more about. And I would heartily encourage people to continue to read your missives in The Atlantic. And we're very grateful that you continue to take our calls and appear on the agenda here on TVO. Thanks so much and take good care.
Thank you for having me. Stay safe.
The Agenda with Steve Paikin is brought to you by the Chartered Professional Accountants of Ontario. CPA Ontario is a regulator, an educator, a thought leader, and an advocate. We protect the public. We advance our profession. We guide our CPAs. We are CPA Ontario. And by viewers like you. Thank you.